As a sequel to my previous video on women's health, let's talk about emergency contraception today. And like last time, this will also be a rehash of a previous ASMR video I made with my friend, Yum Princess. I also wanted to give a quick shout out to commenter Meow Meow Harmonicus for just being thankful for this kind of content and keeping the vibes up. I really appreciate it. Emergency contraception shouldn't really be a controversial topic, but to start with the disclaimer, I would like to remind everyone that I am an American doctor. I can only comment and educate from my personal experience practicing medicine in America, and I just do not know what your local laws might be, like in Canada, India, Indonesia, or the myriad other countries where I know many of my followers are from. From the top, imagine you just had unprotected intercourse with your partner, or maybe you did use protection, but the condom happened to rip. You're in a monogamous relationship and sexually transmitted infections aren't a concern for you two, but you're still not on birth control and don't feel good about just letting this slide. What comes next? I think many people are familiar with Plan B, but do you actually know what that is? How does it work? There are actually multiple options for emergency contraceptives, also known as EC, as recommended by the American College of Obstetricians and Gynecologists, each with their own benefits and drawbacks. For starters, emergency contraceptives are legal and available in all 50 states. Using emergency contraception does not cause an abortion. Rather, it prevents a pregnancy from even occurring in the first place. It's indicated in situations of birth control failure, like a condom breakage, or in any situation with unprotected sexual intercourse. Obviously, it is most effective when taken shortly after sex. EC does nothing for a pregnancy that has already occurred. There are three main classes of emergency contraceptive: the copper IUD, ulipristal pills, and levonorgestrel pills. The copper IUD is the most effective method of emergency contraception at 97%. It is the same one as used in general birth control, and it works by creating a sterile inflammation reaction in the uterus to make sperm less able to fertilize an egg. You remember from the previous video, side effects include increased menstrual pain and heavier bleeding in the first few months of use, which usually subside within the first year. When used as an emergency contraceptive, it must be inserted within 5 to 7 days of unprotected sex. Because an IUD needs to be placed by a doctor or a trained provider, this requires an office visit and a scheduled appointment. Once inserted, you can then rely on the copper IUD for long-term birth control for up to 10 years. Olipristal, aka Ella, is the most effective emergency contraceptive pill at 95%. It is a progestin receptor modulator that works by delaying ovulation. It must be taken within 5 days after unprotected sex. In the US, Ella requires a prescription in order to obtain. But it's also good to know that you can ask your doctor for a prescription in advance that you can fill out at a pharmacy later once having unprotected sex. Regular hormonal birth control methods can be started or restarted after 5 days of taking this pill. Levonorgestrel, aka Plan B, is a less effective pill at 89%. It has a similar mechanism of action, but is less effective than olipristal the closer one is to ovulating. As such, it's recommended to be taken within 3 days after unprotected sex, but it still can be taken within 5 days with reduced efficacy. Plan B does not require a prescription in order to obtain, and it can be purchased freely at convenience stores and pharmacies. It's appropriate to purchase in advance or to keep for an emergency as long as it's within the expiration date on the packaging. Regular hormonal birth control methods can be started immediately after taking this pill. For both EC pills, normal side effects include headache, fatigue, breast tenderness, and abdominal pain. You should also expect your next period to not come on time, along with irregular bleeding or spotting in the week to month after taking an EC pill. It's also very important to know that being overweight or obese may decrease the effectiveness of EC pills, with a recommended cutoff of a BMI less than 30 for maximal efficacy. This might be new info to some people, so to clarify, people of any body weight can take emergency contraceptive pills, but olipristal has been shown to be less effective in people weighing more than 195 pounds, and levonorgestrel has been less effective in people weighing more than 165 pounds. As an alternative, copper IUDs are effective in any weight. No specific follow-up tests or procedures are needed after taking EC, though you should have a pregnancy test if you have not had a period within a week of when you would next expect it. If you're already pregnant, EC pills have been shown to not harm the pregnancy or the health of the fetus. There is a fourth method called the USP regimen, which involves taking several doses of combined oral contraceptives, ethinyl estradiol and levonorgestrel, traditionally used as regular birth control. But it's overall less effective than taking levonorgestrel alone, and therefore less commonly used. The World Health Organization has actually preferred the three that we talked about over the USP regimen, but it can be utilized in situations situations where no other alternatives are readily available. Now that you watched this video, I hope you or your partner will know what to do in the event of an emergency. And knowing is half the battle.